Hi everyone, Dr. Jima here. Today we're going to talk about the monkeypox. Have you heard about the monkeypox? What is the monkeypox? What are the cases we have in the United States? What are some of the symptoms that people that get infected will exhibit? And also, what are some of the measures we have to counteract this type of virus? Let's talk about it. First up, the monkeypox is essentially a viral infection. It is from the same viral group as the smallpox. This was first identified in the 1950s among several monkeys that were found to be infected. There are two typical strains of this virus. One is found in the western part of Africa and the other one is found in the central part of Africa. In the United States, the first case was identified around 2003, and this was as a result of an infection through a prairie dog. The idea here is that the prairie dog may have been exposed to foreign animals and subsequently became an inevitable host and in turn began to spread the infection. Humans and animals are the inevitable host. The reservoir for this type of virus is actually not known, and there are multiple modes of transmission which we'll be talking about shortly. You may be asking yourself, what does it mean when I say a reservoir? A reservoir is essentially the habitat where viruses will live, grow, and multiply. And there is a mode of transmission, which is how the virus moves from the reservoir to the host. The host is essentially the last step in the chain of infection. And in this type of virus, humans and animals are the host. Back to the cases that have happened in the United States over the past several years. Like I stated earlier, the first case noted in the United States was in 2003 as a result of an infection from a prairie dog. What we found out was around May and June of 2003, there were about 71 cases that were identified of monkeypox. Fast forward to July of 2021, there was actually one case that was identified as well in Dallas, Texas. And recently, over the past month or two, we have been seeing several cases around the United States. In May of this year, there was a case that was identified in Massachusetts. And in this case, the patient or the host did not travel to an endemic area. What we know is when somebody is actually exposed to this infection, it takes roughly about 6 to 12 days for symptoms to manifest itself. I must note that majority of people that may have this infection may be asymptomatic, meaning will not have any symptoms. But for those who do express symptoms, these are the things that we are looking for: fever, chills, muscle ache, body aches, lymph node enlargements. And what is very characteristic of this particular virus is that unique rash as shown here. With the two strains that we currently know, there does not appear to be any severe respiratory implications from this virus. What the next few months or years will tell if there are going to be any new variant of this virus is yet to be known. What we know is that this infection actually spreads via a droplet from somebody infected with this virus, and they sneeze or cough on you. If you are in close proximity for more than 3 hours and the distance between you and the infected person is less than 6 feet, your chances of acquiring this infection is relatively high if you are not using any personal protective equipment or if you're not wearing any mask. We also see the infection spread through direct contact with lesions from this virus. If any infected individual has the rash that has been identified there and you come into direct contact with this lesion, you are at significant risk of acquiring this infection. Once again, the symptoms that majority of people will manifest include fever, chills, muscle ache, body aches, and the very characteristic skin rash. This infection and symptoms are managed symptomatically, meaning that we focus on hydration, using anti-inflammatories, resting, and allowing time for complete resolution. Infected individuals that may not be overly dehydrated and weak will be returned home from the hospitals or the urgent care to remain in isolation until complete resolution of the rash. Now, there are some antivirals available. These are the same medications that we have for smallpox according to the CDC. I must note that data in humans is not yet known, although the in vitro studies and animal studies is very promising. There are vaccines available that can be given to people who've been exposed to this virus to decrease the severity of symptoms that they may have. This is essentially the same vaccine we have for smallpox. I must note that although these vaccines are available, they are not currently in use, and it is known that it's at least 85% effective against the monkey virus. What can you do to prevent yourself from acquiring this infection? It is extremely important that you wear masks at all times, especially when you're around people that are exhibiting any viral symptoms. Hand hygiene. Avoid contact with any domestic or wild animals. Also, people with prior smallpox vaccinations do have some level of protection against this virus. I must note that if you do acquire this infection and you are seen by a primary care provider or at a hospital, and the recommendation is to go home and isolate yourself, that you adhere strictly to those measures to minimize spread. You have to remain in isolation until all the skin rashes have resolved. What we do know is that the risk of mortality or the risk of death here with this virus is relatively low, especially in highly resourced countries or areas. I hope you found this video helpful. Don't forget to smash the like button, subscribe, and turn on the notification button so you don't miss out on the next one. Dr. Jiwa, I'm out.